So you really this was particular one is about interviewing a hospice worker, and the experience she had that EMDR did help with.
Well, what I find is that so many people out there don't give themselves credit for being traumatized by the death of a loved one. Some time back I went to be trained to do that first response, to de-escalate first responders and so forth. And my hand kept going up and I kept saying, but people who have lost a loved one, they have those same stress symptoms that you're talking about. And I was kind of, oh, yeah. But it is true. I have seen so many people who are grieving who have post-traumatic stress. And we don't get over that easily.
Mm-hmm.
In normal stress, we can take care of ourselves, time helps us, but if it is traumatic stress to where we might be having some flashbacks, we might be having nightmares, hypervigilance, which means that we're always on guard, something's coming around the corner and going to get me. Those kinds of symptoms, that's not going to just go away with the passage of time. We need a little more help.
Well, there you go. Welcome to Grief and Loss Today. I'm Donna Brandenburg.
And I'm Andrea Harris.
And we're talking about post-traumatic stress and even recognizing post-traumatic stress as a response, as a grief response, correct?
Absolutely. I think that it happens way more often than we think it does. Now, you may have someone where you're not surprised. A patient bleeds out and oh, how horrifying that is. But I had one little gal, a teenager, who on her dad's last day of life, he looked at her, he could no longer speak, and he looked at her with a pleading look. She had post-traumatic stress because she interpreted it to mean that he needed her to do something, but he couldn't tell her. And she was devastated by that.
Felt like unfinished business.
That's right. And so I used some techniques with her that have something to do with EMDR, that I had her draw Dad's eyes and then scribble them out back and forth, because EMDR is a treatment that is effective because our eyes move back and forth. That sounds silly, but it accesses portions of the brain that help us process this trauma. And there are hospice bereavement specialists who are trained in EMDR,
and therapists and
therapists and so forth. But I think that this should be a training that's more widely available, because it works beautifully.
That's amazing. Let's go back to the post-traumatic stress as a response for, there are many situations that can move people into a PST situation, correct?
Yes, there are.
And how do you recognize when you're getting in, you're past the point of depression, you're in depression, because depression leads to post-traumatic stress, right?
Well, it is often a result of post-traumatic stress, because you're living with your adrenaline just cruising through your system. And we're not meant to do that. We're on high alert, red alert at all times when we have post-traumatic stress. That's very depressing. And so those things are linked together.
So it can go one way or the other, actually. Okay.
You can have a number of those symptoms that come. Anxiety is a big one. Having some panic attacks can be a clue as well.
How can a person recognize when they're getting to the point where they really need to talk to someone?
I think that if you're not moving through the grief process, grief takes a lot longer than this society gives it credit for. But if you're not moving from one thing to another, if, for example, you have these nightmares and you just keep having them, you're always anxious, and it goes on for months, The grief process, when you're healing, you may be angry one month, you may be depressed the next month, but you're moving. Things are resolving, maybe slowly, but you're getting there. When you're stuck, we call it stuck. When you're stuck, you're just not getting there. You're staying in the same place. And you need help when you do that.
Do most people in that situation find that other people are giving them clues that their concern is up with the people around them? I mean, that there's a tangible, measurable way to look from even the people around you that you're not processing well.
Well, yes, they will notice those behaviors, obviously, because you're not in a good place. Now, a little caution here, because people will say to you, I have had people who lost a husband a month ago have other people try to set them up with dates. Come on, that's way too soon. If it's an unreasonable length of, sometimes people can't stand to see our pain, and so they try to push us into healing. That's not helpful. But if we just stay there month after month, even year after year sometimes, listen to those folks. It doesn't hurt to ask for help. You can decide after you see someone, this isn't for me. And that's okay. But it doesn't hurt to ask.
Yeah, I see a lot of people who have had other people around them trying to tell them what the grief process is, and what to expect or what they should be doing. You should go visit the grave. You should, because that's part of the grief process. And it's not, because everybody's grief process is different. I have a friend right now that her husband died, and she did not want to go to the grave.
No.
And she really, she absolutely did not want to go. And she felt a great deal of guilt around it, and everybody looked at her and said, you're not grieving, you're not coping with this, you're not doing this, you're not. And the reality was that she really was coping with it, but she was doing it in her own way.
Exactly. And no two are going to be alike.
Yeah, and nobody can determine that for an individual.
Right.
There may be, there's as many different ways to grieve as there are people.
Well, I used to joke that I was getting paid when I was working with grievers. I was getting paid for an easy job, because you know what I'd say? I'd say, what do you need to do? I didn't want them asking me, because what I would need to do in those circumstances would be very different. I'd say, what do you need to do? Well, I think I need to do this. Go and do it.
So I think the conclusion that we can come to, even just from this little discussion here, is the fact that there needs to be a great deal of freedom in grieving and no guilt. There isn't a one right way. There's going to be good emotions, there's going to be bad emotions. It's a very complex process to move through, and to move through it healthy and to be able to live on. But it's very complex, and the only person that really has the answer is the person who's going through grief. And anybody else can just help facilitate it, but that amounts to, holding their hand and just listening and walking with them in a very listening, non-intrusive way, not making decisions for them, letting them process and take time, very gentle, very forgiving, very full of grace and peace, really.
Peace. Peace is a good word for a griever.
There you go. Check out all of our resources. There's many things here that can help you. It's our job to help you grieve and help the people around you.